Today we're going to discuss body mass index, or BMI, in relation to your body contouring procedure. This is a very relevant topic in our industry, and I want you to be informed so you can actually know the implications of your weight and height relationship to your postoperative results. So let's do a few things first. So let's going to talk about the health implications when it comes to the weight. The more, the heavier you are, the more overweight, the increased risk for certain factors. So it's important that we understand that relationship to keep you safe. Now, let's split the categories. So you know that body mass index is the relationship between your height and weight when it becomes to a single number that allows us to have that relationship. Because remember, if you just tell me how high or how heavy you are, we don't really get that relationship. We don't understand. It's not the same that you are 200 pounds and you're 4 feet, or you are 5 feet, or you are 6 feet. So that is important to know that relationship. That's why we resume everything to a body mass index number. So when there are categories, right? So there is underweight, which is not very common, but it's a body mass index under 18. From 18 to 24, or to, let's say 25, is actually a normal body mass index. That is your optimal weight range. Now, from 25 to 30, it becomes in the overweight category. In this category, you are also a candidate for very many surgical procedures still, but it will be probably advisable that you try to lose some weight. Over 30, and from 30 to 40, you are on the obese category, and this category becomes a little more difficult, and things become a little more risky, so we have to take some determinations. I particularly myself don't operate anyone over 40, which is also rare, getting into the morbidly obese category. After 50, it is super obese, and after 40 or 50, you're probably a good candidate for bariatric surgery, something that you need to understand. So now that we understand the categories, I'm going to tell you more, and I want you to understand that body contouring procedures and the procedures that we do, you're not going to lose any weight. This is not weight loss surgery. This is not bariatric surgery. This is actually a surgery that will make you look thinner, but you're not going to probably lose any weight. In fact, if you weight yourself right after the surgery, you are going to be heavier because you're going to have a fluid overload, and you're going to lose that fluid over the first few weeks after the surgery. Hi, this is Magic Surgeon, and I hope you find this YouTube channel very informative and clears most of the doubts that you have about plastic surgery. Remember to subscribe by clicking the red button, and if you want to hear the latest news and updates, just subscribe and click the notifications, the little red bell that you will find next to the subscribe button. And I want to thank you in advance for subscribing to the channel.